Welcome to video series on protein metabolism. What you'll learn in this video: inborn errors of metabolism and its enzyme deficiency, screening algorithm for inborn errors of metabolism, important MCQ discussion, probable university exam questions, and memory tricks revision. Now, why is this inborn error of metabolism topic important? From exam point of view, these are the questions that are probably asked. Discuss various inborn errors of metabolism of proteins and describe screening for inborn errors of metabolism. From patient point of view, screening test you need to know for Down syndrome, screening test for identification of neutral tube defects, and the trisomy 21, that is Down syndrome, trisomy 18 and trisomy 30. Now, the question that is asked here: describe various inborn errors of protein metabolism. These are the disorders. Coming to urea cycle disorders: orotic aciduria due to deficiency of carbamyl phosphatase, due to deficiency of ornithine transcarbamylase enzyme. Ornithinemia due to deficiency of ornithine transport protein. Then citrullinemia due to deficiency of arginosuccinic acid synthetase. Then arginosuccinic acidure due to deficiency of arginosuccinic acid lyase. Then arginenemia due to deficiency of argineinase enzyme. Now, coming to metabolism of phenylalanine tyrosine, these are the inborn errors associated with these two amino acids. Phenylketonuria due to deficiency of phenylalanine hydroxylase. Alkaptonuria due to deficiency of homogentic acid oxidase. Then enzyme. Then hypertyrosinemia. So there are two types of hypertyrosinemia: type 1 and type 2. Type 1 is due to deficiency of fumarate esterase hydrolase, and type 2 is due to deficiency of tyrosine transaminase. Coming to errors associated with tryptophan metabolism, mainly Hartnupp's disease due to defect in transportation of tryptophan across intestinal epithelial cells and also in proximal convoluted tubule of kidney. Carcinoid syndrome, actually it is not an inborn error, but this is associated with tryptophan metabolism. Then coming to errors associated with methionine and cysteine metabolism: homocystinuria due to deficiency of cystine beta synthase. Then cystathionine, then cystinuria, cystinosis. So all these are associated with methionine and cysteine. Cystinuria is also components of Garrett's tetrad, where there is excretion of cysteine, ornithine, arginine, and lysine. Cystinosis is the defect in the lysosome degradation of cysteine. Coming to errors associated with glycine, this is non-ketotic hyperglycinemia due to defective glycine cleavage system, and primary hyperoxaluria, where it is a protein targeting defect. Instead of peroxisome, the enzymes are located in mitochondria. Coming to errors associated with histidemia due to deficiency of histidase, and urocanic aciduria due to deficiency of urocanase enzyme. Then error associated with branch chain amino acid metabolism is maple syrup urine disease due to deficiency of branch chain keto acid decarboxylase enzyme. So these are the disorders and their enzyme deficiency, and this can be asked as a 5-mark. Coming to what are the screening tests that are available to diagnose various errors of protein metabolism. So Nin-Hydrin test, this is a general test for any amino acid. So whenever the child is excreting amino acids in his or her urine, we can perform Nin-Hydrin test, and this will result in development of blue or purple color. And proline and hydroxyproline, which are amino acids, they give yellow color. Then we have the ferric chloride test, which can be done for phenylketonuria, where there is deficiency of phenylalanine hydroxylase; tyrosinemia type 1 due to deficiency of fumarate esterase hydrolase; tyrosinemia type 2 due to deficiency of tyrosine transaminase; alkaptonuria due to deficiency of homogentic acid oxidase. In all these four disorders, ferric chloride test will be positive, where the urine gives blue-green color whenever the patient is excreting tyrosine and phenylalanine in his or her urine. Coming to identification of maple syrup urine disorders, we can do Rothera's test and dinitrophenylhydrazine test. Now this is mainly this disorder is associated with branch chain keto acid dehydrogenase. For homocysteinurias, we can perform cyanide nitroprusside test, where magenta colored complex is seen, and here the enzyme that is deficient is cystathionine synthase enzyme. In phenylketonuria, we can also perform this Guthrie test, where the child's blood or urine is added to the media containing the child urine or the blood is the added, and we have one bacteria called Bacillus cetullus which has got special requirement of phenylalanine as its growth factor. So when child's urine or blood is added, there is abundant growth of this Bacillus cetullus, and this is known as Guthrie test. Now, Benedict's test is done to identify alkaptonuria, where there is deficiency of homogentic acid oxidase, and homogentic acid is getting accumulated. It acts as a reducing agent. So it will answer this Benedict's test positive, giving either green color, yellow color, orange color, or red colored precipitate. Next, for Hartnupp's disease, early childhood test can be performed, and Hartnupp's disease is characterized by defective absorption of tryptophan from either from intestinal epithelial cells or from proximal convoluted tubule of kidney. Now, the other screening test that can be performed to identify this disorder is the paper chromatography or thin layer chromatography, and this helps in identification of specific amino acids in urine. Now, this chromatography is based on partitioning principle between the stationary phase and the mobile phase. There are the polar amino acids have got faster mobility in the mobile phase when compared to the non-polar amino acids, which move very slowly. So based on their movement, we can identify which is this amino acid that is excreted in the child's urine. Now, this is mainly useful for diagnosing multiple amino acids. We can use paper chromatography or thin layer chromatography. So, but the confirmatory test is mainly by mass spectrometry, and this mass spectrometry identifies and measures biomolecules and amino acids based on their mass and charge ratio. So, these are the screening tests that can be performed to identify various inborn errors of protein metabolism. The one more question that can be asked is screening for inborn errors of metabolism other than amino acids. So this is also probably a probable question that will be asked in an exam. So that's the reason why I'm describing this here. Now, what are the indications for maternal and fetal or the prenatal screening? So these indications include advancing mother a maternal age more than 35 years, family history of congenital anomalies, and or previous anomalous baby. So these are the three situations or the conditions where prenatal screening is done. So this prenatal screening is of two types. We can either screen the mother or the fetus in the uterus can also be screened. So what are the screening tests available for maternal screening? So first trimester we can do double test, and this double test, the ultrasound remains common for all the three trimesters along with ultrasonography. So we can do the two biomarker test, pregnancy associated plasma protein A and beta human chorionic gonadotropin. This can be done, this double test is done in first trimester of pregnancy. And in second trimester of pregnancy, we can either do triple test or quadruple test. And the components of triple test include alpha fetoprotein, human chorionic gonadotropin, and urinary estriol. So the quadruple test has got one additional component of inhibin. So these are all the tests that are carried out in the maternal blood or by collecting the mother's blood. So just to summarize this, so PAPA stands for pregnancy associated plasma protein A, and this is produced by in situ trophoblast of placenta. And next is beta human chorionic gonadotropin. This is also produced by in situ trophoblast of placenta. Alpha fetoprotein is a marker that is produced by fetal liver and yolk sac. Urinary estriol is produced by combination of fetus and the placenta. So fetoplacental unit produces urinary estriol, and inhibin A is produced by placenta and ovary. So these are all the different biomarkers that can be measured or estimated in mother's blood. Now, what are the screening tests available for fetus in utero? So, ultrasound can be done in all the three trimesters. Apart from that, chorionic villus sampling, amniocentesis, chordocentesis, and molecular cytogenetics. So, yeah, so chorionic villus sampling is usually performed between 10 to 12 weeks of gestation, and here placental tissue is obtained and different biomarkers are analyzed there. Amniocentesis is a procedure which is performed between 15 to 20 weeks of gestation, where the amniotic fluid is aspirated and various enzyme assay can be performed. Next is chordocentesis, and this can be performed after 18 weeks of gestation, where fetal blood is directly obtained from the umbilical cord and it is subjected to biomolecule estimation. So the next one is, so when any of this test is positive, so genetic counseling has to be conducted and to decide the course of action. So if the parents are not in acceptance mode, so the pregnancy is medically terminated. So if they are ready to accept the special baby, so the pregnancy is continued and various treatment options are discussed with the anticipating couple. So once the baby is born, so the baby can be subjected to newborn screening. So newborn screening, the most sensitive method that is used is mass spectrometry, which identifies and measures the biomolecules based on mass and charge ratio. Usually tandem MS is used. Tandem MS refers to where mass spectrometry is coupled with chromatography, either high performance liquid chromatography or gas chromatography or simple liquid chromatography is coupled with mass spectrometry. Now here the child's heel prick blood is collected and this is used for metabolite estimation. So if this test is negative, the screening is repeated. On repetition also, if it is negative and it is declared and concluded that there is no development of inborn errors of metabolism in this particular child. Now if after doing this tandem MS, if the test turns out to be positive, there are two procedures which can be employed to identify the inborn error of metabolism. Either karyotypic can be done to identify the number and the structure of the chromosomes, or the cell-free DNA from the maternal blood is collected and the cell-free fetal DNA is analyzed for the inborn metabolism. Now these are the most common trisomies that are encountered as errors of metabolism, and this is how we can use the screening test to identify this trisomy. What does this trisomy refer to? So this particular child or person will have extra copy of that particular chromosome. In trisomy 21, this refers to Down syndrome. So this child will have extra copy of chromosome 21, and the clinical features include, now you can appreciate in this image, the face is flat, low set ears, protruding tongue, and upslanting palpebral fissures, short stature, and single palmar crease. So what are the screening tests that are available? You can do the scan where the nuchal translucency is increased. Apart from that, in first trimester, we can do this double marker test where there is decreased pregnancy associated with plasma protein A and increased beta HCG. In second trimester, the most sensitive marker is the quadruple test where there are two parameters decreased and two parameters are increased. You can remember like this. So there is decreased alpha fetoprotein and urinary estrol, whereas increased beta HCG and inhibin A are characteristic marker for Down syndrome. Now trisomy 30 is presence of extra copy of chromosome 13, also known as Patau syndrome. So P stands for polydactyly. Child will have multiple fingers. Aplasia cutis, 3 copies of chromosome 13. Anophthalmia, this is very rare. So anophthalmia means no eyes, okay, but eyes will be underdeveloped. Then U stands for upper cleft lip. So this trisomy 13, the characteristic which are include the cleft lip and the cleft palate and multiple fingers. So we can use triple marker test which is sensitive to identify trisomy 13. Here all the three parameters are decreased. So there is decreased alpha fetoprotein, decreased urinary estrol, and decreased beta HC. So this is the image of the child with trisomy 13 or Patau syndrome. Then trisomy 18 or Edwards syndrome is characterized by extra copy of 18th chromosome. So the clinical features include the microanthia, low set ears, and the characteristic feature is clenched fist with overlapping fingers, okay, and rocker bottom fit. So here also we can use this triple marker test as screening test to identify trisomy 18. So in the mother's blood, all these parameters will be decreased. There is decreased alpha fetoprotein, decreased urinary estrol, and decreased beta HCG. So a simple way to remember this trisomies is trisomy 21. Down syndrome is characterized by friendly face. If you just look out the face of the child, it looks very friendly. Okay, and the characteristic screening marker include there is two ups, two down. You can remember two downs include decreased alpha fetoprotein and decreased urinary estrol. Two ups include increased beta HCG and inhibin A. Trisomy 18 or the Edward syndrome is characterized by closed fist. Okay, and with overlapping fingers, and the triple test is used to identify trisomy 18, and all the three parameters are decreased here: decreased alpha fetoprotein, urinary estrol, and beta HCG. So same parameter triple test also shows decreased, all these components are decreased in trisomy 13 Patau syndrome, and the clinically you can make out the presence of extra fingers. This is how in a very simple way you can remember the trisomies. So this was all about identification of inborn errors of protein metabolism, their screening test, and identification of trisomies and various screening tests and their algorithm, diagnostic algorithm. Coming to self-assessment part, so inborn error of protein metabolism are usually due to enzyme deficiency in amino acid metabolism. Most inborn errors of amino acid metabolism follow which inheritance patterns? It is autosomal. Phenylketonuria is caused due to deficiency of phenylalanine hydroxylase enzyme. Screening test commonly used for neonatal detection of phenylketonuria is Guthrie test. Okay, so where Bacillus subtilis, when added, when the blood or urine of the child is added to this media containing Bacillus subtilis, there is abundant growth of the bacteria. Maple syrup urine disease results from defect in branch chain amino acid metabolism due to deficiency of branch chain keto acid dehydrogenase. So these keto acids are getting accumulated, and we can perform Rotarase test, which will be positive here, and also DNPH test, dinitrofenyl hydrogen test will be positive. Alkaptonuria is due to deficiency of homogentic acid oxidase, where homogentic acid is getting accumulated in the child urine, and urine turns black on standing for a longer time, and this can get converted to benzquinone acetate and can accumulate in the vertebra, and can also accumulate in the pinna, causing blackish coloration. Homocystinuria is commonly due to deficiency of cysteine beta synthase. So homocysteine is getting accumulated. So homocysteine is not getting converted to methionine, and this homocysteine can activate LDL and can predispose the child to development of premature atherosclerosis, and can also cause activation of Hague-Burden factor 12, the causing platelet aggregation and thrombus formation. Apart from this, the child will also have Charlie Chaplin gait because of interference with collagen breaking. The most widely used screening program for inborn error of metabolism in newborn is newborn screening using dried blood spots from here. Tandem mass spectrometry in newborn screening helps to detect multiple amino acid and also fatty acid disorders, because this will detect the biomolecules based on their charge and mass ratio. So multiple amino acid and fatty acid disorders can be identified. Ferric chloride test used for screening of all of the above: phenylketonuria, homocystinuria, hydroxynemia. Ninhydrin test is used to detect what? It is general test for all the amino acids. Any amino acid urea can be detected using Ninhydrin test. The most common chromosomal trisomy compatible with life is trisomy 21, that is Down syndrome. Trisomy 21 is also known as what? Syndrome. So which screening test is commonly used in pregnancy to detect trisomy? So it is quadruple marker test. So which the components include alpha fetoprotein, beta HCG, pregnancy associated plasma protein A, and urinary. Okay. So confirmatory diagnosis for trisomy is done by karyotyping, where the number of chromosomes and the structure of chromosome is performed in first week of pregnancy between 11th and 14 weeks. Okay. And double marker test measures what? PAPA, that is pregnancy associated plasma protein A and HCG. So triple marker test includes three components, and these include alpha fetoprotein, beta HCG, and urinary. The triple marker test is usually performed during second trimester of pregnancy between 15 to so, the quadruple marker test includes all except Papa. So Papa is a component of double marker test and not quadruple marker test. So the components include alpha fetoprotein, beta HCG, urinary estriol, and inhibin A. So this is a more sensitive screening test for diagnosis of trisomy 21, that is syndrome. So in Down syndrome, the quadruple marker test shows how to remember two ups and two downs. And the two ups include HCG and inhibin A. Two downs include alpha fetoprotein and urinary estriol. In adverse syndrome, the triple marker test shows all of the parameters will be decreased here. Okay, alpha fetoprotein, beta HCG, and urinary estriol all will be decreased. Okay, so increased alpha fetoprotein in maternal serum is most commonly associated with neural tube. Okay, so this was all about inborn errors of protein metabolism and the screening algorithm for trisomies. So this brings us to the end of this video on inborn errors of protein metabolism. Identify your score. If the score is more than 50%, highly appreciable. So you can watch the video later at after 1 week duration. If it is less than 50%, it is recommended to re-watch the video and retake all the MCQs. So for getting to get a comprehensive view on the protein metabolism, so you can watch the entire playlist available on the protein metabolism in my channel. So the next video will be on 1-carbon metabolism. So please do like, share and subscribe to my channel. Thank you.